Hi, I'm Dr. Anthony Cave, a Stanford and Harvard trained anesthesiologist and integrative medicine specialist. And here is how you can and possibly should consider irritating, maybe even angering your doctor so that you can get the best medical care that you deserve. And pardon the voice, I'm recovering from a little laryngitis. Let's get started. Medicine's greatest secret is our inner healing potential, and it's most powerful under anesthesia, when we let go of the reality we think we know. I recently had two patients ask me nearly the same question, one just before going under anesthesia, and the other just before their ketamine infusion started to treat their depression. They both said to me, "Doc, why do you ask me so many questions about myself?" I said, "I hope that wasn't bothersome to you. Well, what questions in particular?" They both responded nearly identically, saying, "Nobody's ever asked me about what matters to me in life and why I came to your office in the first place. If I ever had any TMJ, like that pain in your jaw, it went away instantly because my jaw dropped to the ground." How has nobody ever asked their patients this simple but super important question? Why? It's because it makes us doctors really uncomfortable. Because you see, when you ask a doctor something that they cannot measure, they might get really irritated and maybe angry. That's asking them questions like what brings us happiness or joy or contentment, peace, serenity, motivation, inspiration, meaning, purpose, direction. And it's really ironic because these are the questions that matter the most to my patients. Could you imagine going to your doctor and asking them about your purpose in life, your direction, or what motivates you? It would have made me very uncomfortable if a patient asked me that when I first graduated from medical school. And yeah, I probably would have been a little bit angry and tried to move them along and look at their blood tests and their CT scan and x-ray results. It's all that tangible, expensive tests that we order that matter the most, right? At least that was the message I got in medical school. And it's also really funny because we measure bad, negative things all the time. We're so quick to give out Becker depression inventories or anxiety inventories or McGill pain questionnaires. Like we can measure the bad stuff really well, but we get irritated and uncomfortable when we try to talk about the good stuff in patients' lives. So what's the problem? Are doctors and biological scientists supposed to always be scientific and numerical about everything? Well, of course we have to, because you're trusting your lives with us. It's a really sacred responsibility that we have, and we take it very carefully. It has to be objective and reproducible. But just because we can't measure it doesn't mean that it's not real and incredibly important to my patient. And the best part of all is that we are totally unprepared as your doctors to talk about these really important topics that revolve around our consciousness ultimately. As an anesthesiologist, I talk about it a little bit more than other doctors because anesthesia messes with your consciousness, but as a whole, we get really uncomfortable and might get angry and irritated when a patient asks us about these really deep questions, even though they're so important. Our consciousness probably underlies all of the aspects of our mood and happiness and how we feel about ourselves ultimately. And just because we can't measure consciousness doesn't mean people haven't made a ton of money realizing what I'm sharing with you right now. Just look at the sheer number of multi-million and multi-billion dollar industries that skirt the periphery of trying to manipulate our consciousness. Look at the psychiatric sector of the pharmaceutical industry pushing so hard for serotonergic antidepressants or anti-anxiety medications. Or the hormone industry looking at thyroid hormone, for example, with over-the-counter and prescription medications because we know how much thyroid hormone can affect our consciousness and our mood. Or look at other hormones like testosterone or estrogen, gels, pills, injections, once again, because as we age, we know these hormones change and they have a significant impact on our moods. Look at the inflammation industry. How many patients come to me with high sensitivity CRP or ESR blood tests? How many supplements are out there to help reduce inflammation? They're not all bad, of course, but I'm just showing that we know how important the inflammation is to our consciousness, and people make a lot of money trying to sell things to my patients to modulate that inflammation. And how about hemoglobin tests? So many of my patients are so concerned, rightly so, about their anemia because we know that anemia can make you feel more tired and have lower energy levels, and it's important for us to treat it. Although I will say I see a lot of iron pills being prescribed and a lot of constipation coming from it, and we just add more pills for the constipation, kind of like a vicious cycle. And the energy level industry is also huge. Just look at mahuang or ephedra, which we actually use in the operating room. How long has it been used in the United States before it got banned because it had so many deleterious cardiac arrhythmia side effects. So we put so much time and energy in the outside, but we don't actually talk about the core. We totally ignore the consciousness that ultimately underlies so much of our mood, happiness, and passion. Am I being too woo-woo or crunchy granola here for you? Concerns about depression, sadness, energy levels, libido, happiness have affected all of my patients, and I'm willing to bet all of you listening to this video right now. It certainly affected me at some points in my life. So what's more ridiculous or crunchy granola sounding? Excuse me. The laryngitis. So what's more ridiculous? Actually acknowledging the importance of our consciousness even if we can't measure it? Or denying that it exists altogether and letting our patients suffer while we just pretend that in our ivory tower, everything that we've measured in the blood tests appear perfectly normal for them? This is why I call my patients the night before surgery and focus so much on building that therapeutic relationship, even if it's just for one surgery, because each and every one of them are human beings that are trusting their lives in my hands. And the very least I can do is to give them the love and compassion and caring that's commensurate to that level of trust that they're placing in me. And this is why I started my holistic ketamine infusion clinic, because humility is the cornerstone to a growth mindset. And we doctors need to be role models for ourselves and our patients. Just because we can't measure something doesn't mean that it does not exist, and living in denial of that hurts my patients in the most vulnerable moments of their lives. How can we best serve our patients if we don't know what's meaningful to them? That's worth asking your doctor about, respectfully of course, even if it makes them uneasy, irritates, or angers them a little bit. Because medicine is for you, the patients, at the end of the day, not for the businesses, nor for their business models that dictate how we doctors get to treat our patients lovingly and caringly.